Welcome to Neonatal Impedia, your trusted source for neonatal parent and provider information. Welcome to Neonatal Impedia. My name is Meredith and I'm a board-certified neonatal nurse practitioner. Parents with infants in the NICU face unique challenges and often is accompanied by a long hospital course. The purpose of this channel is to help parents and novice healthcare providers understand a little bit more about the different disease processes that affect infants in the NICU. The first disease we're going to talk about is respiratory distress syndrome, which is one of the more common lung and respiratory diseases that affect preterm infants. So before we get into RDS, or respiratory distress syndrome, I want to show you a diagram of the 5 stages of fetal lung development to help you understand a little bit more about what goes on while you're still pregnant with your baby. This is a great diagram of the 5 stages of fetal lung development. If you look in the pictures on the diagram, I like to consider the 5 stages of fetal lung development like the growth of a tree. In the embryonic phase, this is the formation of the primary bronchus, is like the tree trunk growing. And then when you reach the pseudoglandular phase, which is around weeks 7 to 16, you start to get the terminal bronchus, and this is when the formation of the arterial system, cartilage, and smooth muscle form. And this is the start of the branches on the tree. Then in the canicular stage, which is 16 to 28 weeks of life, your branches start to grow out further, and this is when you start to get the air and blood barrier, which is called alveolar capillary barrier. And this is when you still have limited pulmonary surfactant secretion and a small surface area that is available for gas exchange. Once you reach the terminal saccular phase, which is 28 to 36 weeks, your tree now is starting to have buds of leaves. And this is when you're starting to get air sacs in the lungs, also known as terminal sacs. And then in the alveolar phase, this is 36 weeks to 1 or 2 years postnatal life. Your tree is fully bloomed, you have the final alveolar sacs, and you're able to fully oxygenate and ventilate your body. So what exactly is respiratory distress syndrome? Respiratory distress syndrome, or some people call it, you might hear it called RDS, is a lack of surfactant in the lungs. The surfactant production in the fetal lungs usually occurs around 26 weeks of pregnancy. Surfactant is a foamy substance that helps the lungs expand and maintain oxygenation. This will help the newborns breathe better, and they're able to maintain their oxygen levels after birth. Without the necessary surfactant, the lungs of premature babies are very stiff and they're unable to adequately breathe in and out. This will cause the premature infant to have very increased work of breathing, where you might hear a noise called grunting, where they're making a sound after birth, or they might have something called retractions, where they're having a hard time and you see sucking in their chest. So the earlier premature infants are born, the less likely we can keep the baby from having respiratory distress because they have that lack of surfactant in their lungs from fetal development. Most all babies who are born before 28 weeks will develop respiratory distress syndrome. Some of the ways that we can treat respiratory distress syndrome is by adequate oxygenation and ventilation. So therefore, when babies are born prematurely, there's a lot of times that they will need some sort of assisted ventilation. Most likely, if the baby is 26 weeks and up, we can manage their respiratory distress with something called nasal CPAP. It's a mask that goes over the nose and it helps keep the lungs inflated for ventilation, and we can also deliver oxygen through that. Sometimes infants do require intubation, where a tube goes into their throat, and it's what some people will call a breathing tube, and they'll be on the ventilator. There is a medication that we can give, not a medication, we can actually give surfactant to these babies if they have a increased oxygen requirement and if they're having increased work of breathing. Surfactant is made from lung tissues from cows or pigs, and ever since it was developed in the late 1980s, early 1990s, It has completely changed the way neonatal care has been managed, and babies are surviving younger, and their outcomes are much better than they used to be because of surfactant. Surfactant is given by placing a breathing tube in, delivering the surfactant into the breathing tube, and then pulling, and if the baby's stable enough, we can then take out the breathing tube and place them back on nasal CPAP. It is effective pretty much immediately, and we're usually able to wean the oxygen down. Me and you breathe 21%, and babies, if they're above 30 to 40% oxygen, that's when we would administer the surfactant. So how are we able to tell if the baby has RDS? Well, one way we tell is by their chest x-ray. Their chest x-rays will be very hazy, where we can't really see the lung fields very well. And then we have other things that we can look for on these x-rays to tell if the baby has respiratory distress syndrome. So what can you do as a parent of a baby in the NICU who's born prematurely with RDS? The best thing for you to do is be present as much as you're able to be and take care of yourself. Always stay in communication with your healthcare provider. The bedside nurses, nurse practitioners, and neonatologists are all very used to questions, and they will do their best to explain everything to you that you need to know. Also remember that you know your baby best, and do everything you can to advocate for your baby. If there's something that you don't understand that we're doing, just ask again. Most of the things that we do in the NICU, we see quite often, and so sometimes we don't know how to explain it to you unless you tell us that you haven't really understood what we've told you and you need us to explain it a different way. Because like I said, we do see RDS very frequently in the NICU, and it's something that is very common. Life in the NICU can be tough for parents, and it's great for you to educate yourself on your surroundings. Ask your nurses, ask your providers about the equipment that's attached to your baby. Make sure that you understand what's going on. And if you're ever confused, please just always reach out to your healthcare provider so they can explain it to you better. I really hope that you've enjoyed this series. And if you have any questions, please feel free to comment below. I would love to answer questions, and if you have any other questions related to this that I could help you with, I would be more than happy to. I hope everyone has enjoyed it, and have a great day.
Here at Neonatal Inpedia, our mission is to provide invaluable guidance and support to both parents with NICU babies and the incredible NICU staff who support them. We understand the challenges and emotions you face every day, and we're dedicated to be your go-to resource. However, it's crucial to emphasize that the information we provide is not medical advice. While we strive to offer accurate and evidence-based insights, every baby and every situation is unique. Therefore, we strongly encourage you to consult with your healthcare provider for personalized guidance and recommendations tailored to your specific circumstance. As we wrap up this video, we want to remind you that you are not alone in this journey. We are here to empower you with knowledge, offer comfort, and foster a sense of community. Together, we can navigate the complexities of neonatal care, and together we can provide the best possible care for these precious little ones. Please remember to like, subscribe, and hit that notification bell so you won't miss any of our future content. Your engagement fuels our commitment to create more videos that matter. Thank you again for joining us on Neonatal Inpedia, and we look forward to being a part of your ongoing journey. Until next time, take care, stay strong, and know that you are making a world of difference in the life of your NICU baby.